As physicians, we like to help people, and that's all we care about. I am Dr. Rozbeh Torabi.
I'm Dr. Ram.
Dr. Radbeh Torabi.
The Torabi Trio.
A glimpse into lives behind the white coats.
When I would ask people, who do you recommend for this surgery? The answer was always like, well, this one's nice. And I'm like, I'm not looking for nice. I'm looking for skills, right? Like, so I looked into coming to see you, and that's kind of where I found you.
And these insurance companies, there's lawsuit after lawsuit on these AI claim denial.
Go out and sue your insurance company right now. You have notes from the medical oncologist, breast oncologist saying she has breast cancer, and you're telling me like, I need to give you more evidence that she needs breast reconstruction? Like, are you kidding me, dude? Like,
getting Botox or getting lip filler is pretty much the equivalent of getting your nails done at a salon. It's done to enhance your natural beauty.
I just felt like that's what I wanted to do. I really wanted to help people, and I was ready to make the sacrifice I needed to become a physician.
there's a wide usage of laxatives in cafeterias, fast food restaurants, because they want this stuff to go through you really fast. 15% of body weight loss is muscle loss compared to 85% being body fat.
You should fast because that gives your gut a rest and your body to kind of relax and be able to do other stuff to clear itself.
Continue to eat healthy, stay hydrated. All right, well, welcome to Doctor's Life Podcast. This week, we're going to be talking about setting up a successful private practice firm, going behind the business aspect. On the side note, we're going to dive a little deeper into different aspects.
And some of the newer anti-aging peptides versus some of the older ones used. Some new things available at our practice.
We're thinking about like, we're going to go with like how to set up private practice.
Yeah.
Different parts to it that I don't even know about it because you had it set up before I even came in.
Yeah.
What do you think are some key parts to establish early? And then we can go into details of what's really more important and where we made some mistakes. And
We should do this more like a Q&A, like how that kid does it that goes on the streets and is like, you know, goes up to the fancy cars and how'd you become a millionaire?
Yeah, this is where we're going.
Like when I was doing residency, I moonlighted, which moonlighting means I did my regular work hours, which weren't 80 hours a week, but likely more. And then on the weekends, I used to drive from Long Island to Philadelphia to work extra shifts. I was either, it was surgical specialties, usually watching over ICU, some cardiac ICUs.
This was in fellowship, though.
In fellowship,
so you finished residency.
Yeah.
This was in fellowship.
In fellowship.
Because you can get your residency into troubles.
Yeah.
Who cares?
Who cares? I did like first assisting. A lot of it was just sitting in a room and just watching TV pretty much.
Yeah. Overnight in-house calls.
Yeah. In-house calls. And, you know, I got paid pretty well. I saved all that money. I took a few trips, but saved all that money to
You didn't really take many
start
trips
my
at all.
practice. You know, once I started practice, I shared an office with one of my mentors throughout my years, and he passed away within that first 6 months. And the problem was, you know, like figuring out what you're going to do, trying cosmetics or doing reconstruction and taking ER call and everything. At the time, it was easiest to take ER call. Right now, I would probably not tell many people to take it. Although with the stipend, you could probably function and start a practice. It's just if you're taking too much of that call, then you don't have the availability, and you might burn yourself out and just taking care of patients. I've also
heard of the starting rates going for like just private plastic surgeons, new grads. Like sounds like garbage. Like can supplement it with some stipends for taking trauma calls, but some of these contracts you give up that stipend. I
had my friends that I would be moonlighting and they still continue to moonlight when they were in practice.
Yeah.
Because it paid better than some of the contracts they had.
Yeah, you got to ask about the numbers and like make sure the numbers make sense.
Yeah, especially if you're not flexible in where you want to live, you want to work for someone, it's going to be, you know, it's going to be tough. So if you're more flexible, there's some areas of the country paying plastic surgeons pretty well, but like come back to where you want. Like for me, I didn't even interview. I was like, I'm going to do this on my own. But like, I know some people were interviewing, and I'm like, I could have made more money being a general surgeon out
Yeah.
here in Arizona than adding another 3 years without getting paid much.
The main factor I will say I've seen repeated people make less money than they should make is when they've had geographical restrictions. They're like, I can only live here. So you get limited to your job opportunities. Not saying you got to go live in like bumfuck nowhere.
Yeah.
But there's opportunities if you're willing to go to different areas of the country. It's like, oh, okay, that's an extra $200,000 a year to start off for like your first 2 years.
Yeah.
It just means you're going to make more after those first 2 years. So it's something to like really like.
Well, then you got
about.
our broke brother Radbeh, who's
who's
working in a sinking ship and thinking he's going to make it out.
He's going to be fine. He's going to be okay.
Yeah.
I'm just.
But his hospital's a sinking ship. They just fired like all their higher ups.
Rhode Island Hospital Systems with Brown University.
They bought some of the Stewart Health system.
That's why the CEO got fired. CMO got fired. There's a reason for that because it's just utter mismanagement. And it's not about getting like physicians paid or anything. Bottom line is taking care of patients and being able to make money doing that. Like you're a huge organization. You're the only major hospital system in the state. They shit on themselves and everybody around them.
Yeah, I started with doing trauma call, but like the thing is I came in at the right time, and training in New York kind of gave me that New York hustle.
You say you came in at the right time. Yeah. So you have to be.
I could have been an even better time.
You have to assess your timing, right? Like it doesn't matter what you were able to do like 6 years prior to me jumping in. Like I have to assess the situation for like what's going on right now. What are reimbursements like? What are stipends like? What can I expect to make from like cosmetic procedures realistically, like in a first year, second year, third year?
But like you also came at a hard time. It was COVID, and also the whole out of network or balance billing rule came in. So they're both like backfires in the setup I sort of had. We were still getting okay payments from the insurance companies, but they were starting to dwindle down.
So things change, and I don't know if somebody could graph this, like regularly physician reimbursements decrease over time.
Yeah.
Unlike anything else, like if you put up like a chart of salary at Salads to Go compared to physician reimbursement, they're going to be completely like reverse correlated.
The thing, just like you were saying with Rhode Island Hospital, and we deal with it in our practices, salaries went up, you're still getting, you get paid the same or less. That's where we moved away from, doing a lot of the trauma stuff, was because we were actually losing money doing a lot of this stuff. You're taking care of these patients, doing dressing changes. You're paying people to take care of these patients as well, and you're not getting reimbursed for them. So what ends up happening is, you're bleeding out money. That's where we're like, all right, we got to take a totally different route, and found passion in the cosmetic realm, doing aesthetic surgery. Not that I didn't have like passion for doing aesthetic surgery, but like taking care of cancer patients and trauma patients, and
more focused point of practice.
Yeah.
Because adding call brings like a huge diversity to the practice, which I really like.
Yeah.
But people are like, oh, you don't like taking care of people. You're willing to do mission trips, but you won't take care of patients in the US. It's like, no, it's like if I do this stuff, I'm actually paying to do this work.
Yeah.
Like I have employees to pay. And
a mission trip's a set amount of time you're there. It's not like
it's your vacation time.
Yeah.
I don't have to pay people in the office for post-operative care and stuff.
And spending time without your kids, or family.
So I did not want to give up trauma. I'm generally very happy I did. It was definitely the right move. It's not like this is the way the system's going. You have to pay people to do the work.
Yeah.
Like it can't continuously lose money doing this in private practice. So it's different in academic or large like private practice, private equity owned firm where you could potentially be profitable doing that. It's still hard.
Yeah.
It's nothing I would recommend to anybody trying to do.
For me, it was more the health benefits of not taking trauma call, because like one thing is the stress, and it wasn't a good type of stress. And the other thing is, how important I take sleep at this point is like,
you get woken up for
for a broken nose
reasons.
that you're not going to do anything, you still get woken up for it, or, stuff that came through the ER.
It kind of gets you irritated when
you're
answering the call. Not that I was ever like, I think anybody can attest to this. I never like responded poorly, even if I got woken up at like 4 a.m.
Yeah.
But like it irritates you, even if you don't show it. And then the next day, it irritates you because you got woken up for no reason.
Yeah. And then, also like the patients that I have, I wanted to give them the best care. And, being woken up at night, or, you're like running out of your office and going to, doing your trauma cases at the end of the day, or pre-planned cases, it took a lot of time away from the patients that I actually had. And, it was just like, it
was way too much.
And we're not like getting reimbursed for it, and we're actually losing money on it. Like there was the point, when I looked back at what we were billing, and like there were days that I didn't even get paid for. And it's like, when you transition between billing companies and stuff like that, like you lose all this other revenue that
not just that, like even if it's running, like just for people out there, like potentially starting out their practice or looking into different options of what you're going to do outside of training. Like our practice, we have about 12 employees.
Yeah.
Probably $20 to $25 an hour average wage.
Yeah.
So that's $250 an hour that you have to bring in, or you're losing money.
Yeah.
Right. And then like you have Medicare rates that pay maybe $1,000 for like a 5-hour case.
5 hour.
Like that it just doesn't make sense. So you have to know that the numbers, these are the reasons a lot of restaurants go under. Like you don't understand the numbers, kind of like invested your time and money. So you got to make sure this works. It's not easy changing professions once you've finished training in medicine. Within training, it's still difficult, but doable. But afterwards, unless you find something adjacent.
But a lot of people are getting out of medicine and doing other things.
They are. For this specific reason. Like you can't keep paying people $15 an hour or expect them to go through 4 years of med school and 6 years of training. It's going to get worse. It's going to get worse. The demographics going to get older.
Yeah.
The physician group is going to dwindle down, and the reliance is going to be on mid-level care and AI. And I don't think it's necessarily there.
Yeah.
Until people start diagnosing themselves.
Yeah.
It's like, okay.
Which they already do, and it's going to just become more prominent.
But it's going to, because they're not going to have an option. I can't see a doctor for 9 months.
Yeah.
And my heart's beating on my chest.
Yeah.
What am I feeling and what should I do?
Yeah.
And now you can get medication on online pharmacies, like from random sources, which is totally unsafe.
Well, with the whole peptide thing, you have all these non-physicians that are like YouTube stars selling it.
It's not just even the peptide things. It's regular medication.
Yeah.
Like regular medicine that you might find this crazy third world pharmacy that sells it to you for cheaper than your copay with your insurance.
Yeah.
It's like stuff that's going on in the best healthcare system in the world. I don't know. Sounds abysmal.
Yeah.
We need to talk about some more positive stuff.
Well, that's the positive part about plastic surgery. You can turn it into whatever you want. If you want to bleed out money, you can sure bleed out money, but
There's easy ways to bleed out money.
You could market yourself and do pretty well just as a cash run business and just do cosmetics. And that's why it's a highly sought after specialty. You see all these people trying to pose as plastic surgeons. So that's what makes it like so special is like, there's people that shouldn't be doing what they're doing, but they're trying to become whether it's a dentist or a family practitioner or could be
in
a
the
car
crypto
mechanic.
world. In the crypto world, we call them derivatives.
Yeah.
It's not the first dog coin, but it's like the third dog coin. It's your cosmetic surgeon, board certified.
People are board certified plastic surgeons that should not be doing what they're doing. So
that is true, but it's a little more stringent.
Yeah.
A lot more training.
The likelihood of a bad one coming about, it's a lot less than what you see in the other world. So
very true.
On our last one, we were ending with, we're doing the Wolverine stack, and that's going to be great for our patients healing up and everything, getting them back into their normal activity, decreasing like their scarring and everything, and healed up pretty fast and quick. There's different peptides in it. We have it in a bundle. We're going to run a special.
What's in the Wolverine stack?
We have GHK copper, which is a peptide. It actually, I was listening to a recent podcast, and they're talking about how it modulates and changes like 4,000 genes in your system.
I think anything changes 4,000 genes. So it matters how it gets so.
Yeah. But it's like excellent for the skin, but it's like it works on a lot of other systems, gut, anti-inflammatory, arthritis, you name it, like viral, building collagen.
To simplify things for people, like anything that's exposed to the outside world, you don't realize your gut's exposed to the outside world. Your body's built like a donut. Your GI tracts the inside of the donut. Your skin's on the outside, but all that's exposed. And you have special like immune cells and responses to
most of your immune cells in your gut.
If you can get all your like major immune responses in balance to like outside stimuli, like it's going to be beneficial.
And I think the important part of GHK and the Wolverine stack is more the collagen inducing effect it has. The other things are, BPC, thymosin beta-4. BPC, it increases vascularity to the areas.
So the collagen inducing, is that mostly skin? When you say collagen inducing?
Just overall everywhere. But skin's one of the main ones that it's used for, and most people know it for.
So BPC is great for gut health.
But when taken in injectable form, it's great at healing and, like there's the mice model that it repaired a tendon. Some people, inject it. If you get it sterile, you can inject it into knee joints and stuff with like partial ACL tears and meniscus tears. And there's been post MRIs done and like in humans that areas have completely healed. And even some patients post-operatively, after orthopedic surgeries, like some of their orthopedic surgeons don't know how they healed up so well and so fast. And, the peptides are making a huge change in that. And your thymosin beta-4 is going to help you, get the immune cells there to help with the repair.
That goes by TB4 for short?
TB4, or it was known as TB 500. And then the other ones, since they got rid of CJC ipamorelin, do tesamorelin, doing lower doses because the recommended doses can get pretty expensive. But it's already it's already a more powerful growth hormone releasing hormone than like CJC.
Really?
Yeah, especially at, getting rid of fat and also producing more growth hormone and releasing more growth hormone. So what it's going to do is it's going to overall help with the healing process. So that's that's the fourth thing in there to help with improving that.
Go through the 4 again, real
So
quick.
GHK,
GHK,
BPC, TB4, and tesamorelin. All of them help vascularize the tissue, help the heal. Once you have a cut, you're going to get growth hormones there. You need it. That's going to help to vascularize the area. But this is going to increase the amount of growth hormone and growth factors that you have in the area and the immune cells to function.
How would
heal.
this help somebody without surgery? Would this be a good option for some people?
If you have an injury or something, like BPC and TB4 are always great for any healing process, like workouts and stuff, or if you have aching joints or muscles, it's great at helping with that. And it's been well known in the bodybuilding industry. Of course, like can't take it. It's not WADA approved. So if they find
WADA?
it, yeah.
What's that?
WADA, that's the World Athletic, it's the drug, whatever.
Gotcha.
Yeah.
It's the
I don't know what
FDA
it's
for some type of sports.
Yeah. The thing about these peptides is the peptides are already in your system. So it's not like you're putting something that's like really foreign in your system.
Amplifies the
it just amplifies
amount
everything.
your body creates it.
But then there's these bioregulators, which are even smaller. You know, the peptides can be up to 50 amino acid chain. The bioregulators are like
peptides.
What?
Peptides are small protein segments.
Small proteins, yeah.
Small proteins. So proteins, peptides made up of amino acid chains.
Yeah.
Peptides that you're talking about.
The bioregulators.
Bioregulators, 50 amino acids.
No, the peptides I'm talking about, they're like up to 50 amino acids, like BPC is 15 amino acids. Then you go to peptide bioregulators, which are 2 to 3 amino acids. And those can actually be taken oral, or they have droppers and cream. And droppers are just under the tongue or something. And they're small enough that they can get into cells. And some of them are just portions of like animal, like thymus gland or thyroid gland and stuff. I think that's why, like, for some people, like taking some supplements that contain like adrenal gland or thyroid gland and stuff like that helps with their healing process. And these are just stimulating the stem cells to grow. And you have all these stem cells in your body and in your different organs, and they're kind of there to help it heal. So what these do is go and stimulate these stem cells to help itself heal.
Yeah.
And it's not going to, like what one person said that totally makes sense is like if you take the thyroid hormone bioregulator, if you're hyperthyroid, it's going to take it down to where you're euthyroid. And if you're hypothyroid, it's going to get it repaired so you're normal thyroid. But
I did some research with stem cells.
Yeah, and if you overdo it, it's not like it's gonna shoot your thyroid down. It's just there to repair it.
Homeostasis.
So it won't do anything extra. But these are more for repairing your system,
signaling the cells to do the appropriate thing. Because if they're not signaled appropriately, they can do weird things like turn into like cancer cells and stuff like that.
These are small enough they can get into the nucleus. They can't cause cancer. The research that's out there, it's mainly Russian research, and they're becoming more available in the US. But the main guy that did most of the research is the Russian guy. And like one of the most famous ones, and I've used it plenty of times, is epithalon. Works on the pineal gland, a pine-shaped gland in your brain, and it releases a bunch of hormones.
Very tiny, right?
Yeah.
It's like that big.
Yeah, but it calcifies.
Right,
I forget when they said it starts to calcify. It's like in your teens or so. It starts
probably
to
in like 20s to 30s. Yeah. It starts to gradually deteriorate.
Yeah.
What's the pineal gland? What does it do?
So one of the things it does, and that's what the epithalon works so great at, is for melatonin release. So it releases melatonin, which helps with your sleep cycle and circadian rhythm. That's where epithalon comes in. You could use it. You're not supposed to use it all the time. You do 10-day cycles twice a year. Yeah. And
Because you don't want to burn out your glands.
Yeah. Your own melatonin production, because if you overdo it, then you're not
Reliant.
gonna, yeah. And it changes. I heard 3 gene expressions on your melatonin producing DNA.
Is that the tRNA or the mRNA?
I don't know.
Making shit up.
We had our special guest just show up. So
Superstar.
So
Great
we'll have
attire.
him talk to us. How many bottles of baby oil was found at Puff Daddy's house?
Was it baby oil or KY jelly?
I don't know.
I honestly have
I thought Ram had some personal experience at P. Diddy's house. So
He always invited me, and I would tell one of
So
these
do you
guys
think
to go
P.
over there.
Diddy's going to tell us that he killed Biggie before he kills himself?
After Biggie finds out? After they find out.
Kills himself.
Rod's favorite artist was Michael Jackson, who started this whole debacle
Yeah.
of children getting.
I don't know. Michael Jackson looks like a saint compared to P. Diddy.
Yeah.
The guy's just like, how can we scale this operation?
That is a valid point.
Or we just know more because of social media and stuff.
I don't know. I think people were more scared to come out. Now it's like, I don't think people are as afraid, or I don't know how this whole thing came out.
I don't know how it's all going to play out.
Yeah.
It's going to be just
How it's been under wraps for this long as well. Like how, I mean, he's pretty active in the media. It doesn't make sense. He's at his own shows.
that clip
all
you
this
sent
kind of
today
stuff.
was kind of spot on.
Which one?
The Law and Order SUV
Oh, yeah.
clips.
So many people were petrified of him too, like Mike Tyson, and people just didn't want to hang out with him, because it was trouble.
Goes
Should go
back
and
to,
ask
like-
J-Lo, because what was he like, her third husband, or did he actually get her a ring?
J-Lo got
Or-
another ring last year, right? She's not only beat out the Dallas Cowboys, she's going after the New England Patriots.
Yeah.
It's got more rings than any NFL team out there.
I wonder, like, when they were together, like, what the hell, like, if this shenanigans was going on. Must have been going on.
Oh yeah, it goes on 24/7. This isn't something
It's
you
like,
turn
oh,
on
that's
and
Diddy.
off.
Just,
Just doing his
Whatever.
thing.
but he
If
was
there's
more
ever
in the
anyone you saw
spotlight.
It's like,
back then.
we have a Zoom call at 5:30. No, I can't make it, man. I got my freak off going on. Come by at 7. Every time that's why he's all glistening, is because of all
So
those
let me ask a
bottles.
question from you guys. So what would you do with 1,000 bottles of baby oil?
What exactly happened? He
If
was
someone
just-
gave you
did they-
1,000 bottles of,
was he just
you
going
won a
nuts
raffle
with-
and you got 1,000 bottles of baby oil, what would you do?
Set up a wholesale account from McKesson to get baby oil on a discount.
And make sure Saran's bum was clean.
So if you were doing a lot of BBLs, it might be good. You just like get them on camera.
I don't know how you could hold on to anything. Everything would be slippery.
What was his deal with baby oil? I'm so out of the loop.
There were over 1,000 bottles of baby
Baby
oil
oil.
or lube found at his house.
I would have thought it would have been
I
cocoa
have
butter.
not confirmed.
That was what they like.
I
We
have not
went in and we
confirmed, but it
confiscated
was-
1,000 bottles.
Over.
I don't watch
1,000
news. I get
bottles.
all my news in the OR, and this is what people were talking about.
Yeah, I just go by
Hilarious.
hearsay.
That's
Bruce said it, so it's got to be facts.
Yeah.
That's funny.
But it sounds pretty legit. I've
Yeah,
heard it
yeah,
from
yeah.
multiple sources.
Yeah, if
And I
anyone was
Googled it
going to
once
do
or
it,
twice.
obviously would like you just look at Diddy and you're like, yep, yeah. Oh, that wasn't
Dude
obvious.
is always shiny.
yeah.
He's always glistening a little bit.
Listening and yelling at people.
Dude, it all makes sense.
Cambodian milk. What's
Yep.
up with that?
The Chappelle skit.
Oh,
Yeah.
oh
where
yeah.
He's in the house.
I only drink the
My
finest
house, the
Cambodian
finest
milk.
Cambodian milk.
Run to the corner and get me. It's just like, it makes sense. It was just like, I don't think any of this was exaggerated whatsoever.
Dude, Chappelle.
That's way less
That
than
Like my
Chappelle's,
doo-doo
dude,
glitters.
that Chappelle skit. I'm like, did Chappelle just do that skit?
sprinkled diamonds on my food. So it makes doo-doo glitter. No,
I
it's a
thought
lot
it
of that
was,
shit.
like so ahead of his time.
No,
and
a
it's
lot of
coming
that
out.
stuff is just based on things he saw.
Yeah.
I'm 100% convinced.
It was crazy because I sent you that. I think I sent you that skit last night,
Yeah.
and that's like,
Oh, the
I'm like,
Chappelle
holy
skit?
crap. Yeah,
Yeah.
it's like so spot
He's
on.
always, yeah. I mean,
It's
he was
like
spot on.
some of
about
the
a lot
funniest things, like
though.
South Park has been like spot on,
Yeah.
despite them like releasing on like 7 days notice.
Yeah.
It's kind of insane how like you can go back like 10 episodes and be like, oh, this is like they had the whole
With the
series with
COVID situation.
Oh, prior to that,
insane.
remember you actually came and visited me in Michigan back in like 2007 or whatever. They were making a spoof about, I think it was Romney against Obama, and their whole thing was two people running, and one's like one candidate's literally a turd sandwich and the other one's a giant douche. So they're just going on these debates, and the whole debate is like, you wouldn't know, you're a turd sandwich. It's like, I'm not a turd sandwich, you're a giant douche. It's like, no, seriously, you're an actual turd sandwich. And then that's just how it go on. And it's like, it's all I've heard in debates since then.
Yeah.
It's just like, oh, this is 100% accurate. No, you're a giant douche.
Yeah, to think they only have a week to prepare that stuff, they do a great job with it.
Yeah.
It's pretty nuts.
But I'm excited for this election. It's going to be awesome. Everybody's going to be farting fucking rainbows and Pop-Tarts. It's going to be great.
Man, the amount of text messages I get, who am I voting for?
Oh, how'd that happen?
Voting
I
for
thought
it's
they-
not voting for it. It's the 600% match is even better. It's
What
like,
is
oh
that?
yeah, hey, donate here or click on this and donate to us. Just give us your money. We're not random people who are trying to steal your money.
Or even if they're not, even if they're legit, like, what am I giving my
Yeah,
money
I just
for?
say, I say
For you
Allah
to send
Akbar.
me more, like recruit more people to send me more messages.
At least like
But what do you
8 to 10
guys
texts
think
a
about,
day.
like, you don't need to have proof of citizenship to vote? Didn't think that was like an actual thing. I thought, like, you had to be a U.S. citizen to vote.
Do I have to prove
So all this
do I have
time I didn't have to be
prove
a
my,
U.S. citizen to vote?
citizenship to not vote? I'm gonna. Here's my green card. I'm gonna stay home today.
But you can't join the U.S. Army if you're not a U.S. citizen, right?
I'm pretty sure there's workaways around that.
Yeah.
Yeah, I'm sure they could figure something out.
I don't know the details. The whole like ID verification thing. There's so many loopholes.
Yeah.
Like, I don't get it. That's my final stance on that.
But I don't see how you could say you run a fair election. Like, no matter who wins, like, you're not checking IDs, you're not checking citizenship. I don't know. As a U.S. citizen,
I think it's going to work out against them personally, because I personally don't think they're going to be able to guide their exact votes.
Yeah.
And at least 50% are going to vote the wrong way.
Yeah.
It's just how poorly I think it's going to get run, where it's like this grand scheme to do things, but we know who they are. They don't do shit properly, and there's loopholes, and they're going to fuck up so bad that they're going to drive illegal immigrants to the ballots, and they're going to cast the wrong votes.
Yeah.
Hot take. Hot take.
Oh, President Trump's going to write.
It definitely can happen.
Trump's going to write our amigo.
There's
They
like a
definitely-
50% probability that's going to happen. If they could mastermind that and pull that off, they can do way better with our like tax incentivized programs of like, oh, get more books into kids' hands, stop like mass shootings, like run a service that's maybe comparable to Amazon delivery service or UPS, like for a fraction of the cost. It's like they just can't. They're inept.
A lot of it just sounds like, I think we said this before, it sounds like someone's running for high school president.
It's
like,
worse.
we're going to bring candy to the lunch line,
It's worse. At least you knew that was not going to happen.
Yeah.
Like
We're
free
going to have
candy
more
for
recess.
everybody.
Recess is going to be 2 hours instead of 1.
Everybody's going to be cool next year. Like, it's just not going to happen. All right. One thing I do want to talk about is, do you think the country is going to be crazier between November to January if Trump wins or if Harris wins?
I think
Everybody's
more
concerned
of Harris.
about. Okay.
Probably
you-
Harris, I think. I think there'll be more of an uproar.
I think there's going to be people throwing their uteruses at freaking cop cars. If
Well,
Harris wins.
it's a tough call. They've tried to kill Trump twice already, so the guy's gonna walk around with like fucking bulletproof everything.
Bulletproof orange skin.
Or they're gonna just dress up some Joe Biden as President Trump. And
He's
have
got to
him
do
walk
that.
out there.
What was it? They said like Saddam had like 20 body doubles.
Yeah, I know.
And he was still
Just
caught
spray
looking like a
tan,
rat
fake wig.
bastard.
I mean, whoever's tried to kill Trump twice already.
It's like if you catch a large discolored rat, like I got Trump.
It's going to be a mess no matter what. It's just a complete shit show.
I think it's going to be bad either way, and each candidate has to play their part in cooling that side down. And again, they're going to be inept and unreliable.
So going
So-
back to the peptide bioregulators, Putin's gonna like outlive all these fuckers.
Maybe
Because
he might
he's
get
gonna be
shot
on
in
that
the
ship,
head.
unless he gets shot. Like I think he's gonna be well protected, and he's using all this crap that it's not crap. All this.
Well, he
stuff
scored
that-
like 20 goals in a hockey game
Hey,
with
is
all
there-
other professionals.
Speaking of peptides, I know this is off topic, but does it affect what's the latest with anesthesia and
What do you mean? Which
semaglutide and
peptide?
no, like
Oh, GLP-1s?
Yeah,
So
because they're the whole
some
anesthesia.
anesthesiologists
we
want 2
haven't
weeks.
discussed this, but yeah.
You haven't?
No, I don't think we have, but
Yeah.
the recommendation is 1 week. But
No, it's recommendations 2 weeks.
2 weeks? I
think
would-
the
I'd-
decision-
2 weeks.
I say 2 weeks
Stop 2 weeks.
because it's a weekly injection.
Yeah.
And yeah, I would
I
say
tell them 1
2
week,
weeks.
but like I say, like the 3 nights before surgery, do not eat hamburgers or extra fatty stuff. Try to take
Okay,
it
that makes
lighter.
sense.
When they do suck out some of these patients' stomachs, that we have to do quicker than that, and they're on it. And like you see, their food comes back from like 3 days
Oh,
ago.
interesting.
Yeah,
Okay.
yeah. Even
Unless
when
you're
they're
in New
NPO.
Orleans, you just find red beans and rice in everybody's stomach.
It's like, oh, looks like somebody has.
We did have a
jambalaya.
we did have a patient. I hate to laugh about this, but it was pretty funny. He was like young 20s, got shot in the stomach, critically ill, had to rush him into the operating room. Just like everything's like in his abdomen, like all the food he consumed, just like trying to like literally scrape out like all
All
the
the food.
buffet out of
Oh,
there
God.
to control some bleeding.
Oh, God.
We go to talk to his parents. It's just like done everything we can. We're continuing to give him blood products. He had a lot of food particles like red beans and rice. And his parents were like, "That boy sure loves his red beans and rice."
What was with red beans and rice?
It's a classic New Orleans dish.
Oh yeah.
His stomach was like blown up with red beans and rice, and then stomach had a hole in it, so it's gonna leak out into the rest of the abdomen. One of the coolest experiences I had this week. Anytime you're listed with like a co-surgeon, like you have the breast surgeon's first initial, last name, and Ram Andrews came into the OR to assist with the case. So the OR board, after I walked out from that full day of surgery, just said, "R. Torabi, R. Torabi, R. Torabi." I was like, that
That's
just
awesome.
made my freaking day. Like that's like I can't explain like how much that means, and to be able to like come into clinic, see both you guys there, even though I don't talk to you much. It's kind of cool, like signing up to the same
Yeah, it's
gym.
pretty awesome.
Not that we've gone to the gym together yet, but eventually
Our
we have
gut
hopes and
speaks.
dreams, and it's closer than ever before.
Yeah, it's awesome.
So that was a really cool experience, and I know you've just started doing cases with Ram and stuff.
Yeah, we just got to get them up to par with the different credentials, which
Yeah.
like the credentials, I can get them the easiest. Like it's just taking the longest,
Yeah,
which is the Honor Health System.
yeah. It's like,
Uh,
please sign.
Yeah.
Please sign.
Yeah.
Whoever needs to sign, just sign. Yeah, it's amazing. It's nice. It's awesome coming in with you guys. even if I'm a med student for you guys at times.
No, not really. Pretty good at what you don't do.
Oh, I have a funny story from today, actually.
Oh yeah, let's hear it.
So
Not the stripper in the
we can
west.
always cut
no,
it.
so my wife,
We can always cut it.
my wife has been telling my mom to not cook with spices. So today she's taking care of my son, and she decides to make rice with spinach and garlic. So the whole house smells like garlic. This probably can't air because my wife's pregnant and she probably doesn't want people to know.
The nice part about
But
this stuff
I just
is
didn't
I know
realize
for
that.
a fact Sarah doesn't tune in, so don't worry about Nez.
Oh, Nez watches it. Don't worry. She's like the first
She
one
probably
to like
does. Oh, does she? I don't know.
Well, no,
Yeah.
like some of the stuff.
Yeah.
They're
If
not
she
interested.
sees you on
They're
it.
not interested. She doesn't listen to you talk to her at home. She's gonna like log into a website to hear you speak.
Dude,
I
she
highly
gets
doubt it.
yelled at
She
about
will.
every other word he
She will.
says.
She probably will. She'll be
It's
like, "Why
probably
did you
more
look
of
terrible?
one, yeah.
Why'd you look terrible that
Clean
night?"
shave. Okay, sorry, I keep cutting you off.
Yeah, no. So she makes food with garlic, and this is just like she felt like crap tonight, and then it just stinks like garlic. We have a battle to get Saran to sleep. We get him to sleep, and he can only sleep right next to her. And his mouth just reeks of garlic. So he's like, Anne, which means mom in Turkish, and he's just rolling into her. And I'm like on the side pretending to sleep, like just dying laughing inside because she's losing it. And then she couldn't do it anymore. She got up, she went to the bathroom, got a toothbrush, and just came back while he's in bed and just scrubbed his teeth with a bunch of toothpaste. And then went back, sit next to him. It was hilarious.